Hello guys, my name is Zulfiana R. Hello guys, my name is Zulfiana R. And I will to present about dengue fever, clinical picture and diagnosis. Okay. The content I will be loaded in this presentation is an overview, description, symptom, diagnosis and treatment, risk factor, prevention and clinical trial of dengue. The one is overview is dengue is viral infection caused by dengue virus DNV transmitted to human through the bite infected mosquitoes. About half the world population is now the risk of dengue with an estimated 100 at 400 million infections occurring each year. Dengue is found in tropical and subtropical climates worldwide. While many DNV infections are symptomatic or produce only mild illness, DNV can occasionally cause more severe cases and even death. Prevention and control of dengue is depend on vector control. There is no specific treatment for dengue and severe dengue. Early detection, access to proper medical care greatly lower fatality rates of severe dengue. The next is description. Description is dengue viral infection caused by the dengue virus DNV transmitted to human through the bite infected Aedes species Aedes aegypti or the Aedes albopictus mosquitoes. The symptoms. The symptom is headache, nausea, vomiting, restlessness, rash, and fatigue. The symptom. Most people with dengue have mild or no symptoms or no. Most people with dengue have mild or no symptom and will get better in 1 at 2 weeks. Rarely, dengue can be severe and lead to death. If symptoms occur, they usually begin 4 at 10 days after infection and the last 2 at 7 days. Laboratory diagnosis. CBC, serological test, and the last is PCR. CBC is complete blood count. Serological test is for antibodies, and PCR is polymerase chain reaction test. Treatment is pain medicine. Preventing mosquitoes bite is the best way to avoid getting dengue. Number 2 is acetaminophen or paracetamol is often used to control the pain. And the last is fashion. For people who have had dengue at last one's life place where disease is common. The risk factor, the one is previous infection, DENV. Number 2 is vector control. Number 3 is urbanization, and number 4 is climate change. WHO strategy. I will to mention only 3. You can read about this by yourself, okay? Number 1 is support countries in the confirmation of outbreaks through its collaborating network of laboratories. Number 2 is provides technical support and guidance to countries for the effective management of dengue outbreaks. And the last is supports countries in improving their reporting system and capture the true burden of disease. You can read it. The next is by yourself. Okay. The next is prevention. Prevention number one is clothes. Clothes that cover as much of your body as possible. Number two is mosquito nets. If sleeping during the day. Number three is use window screen, coil, and vaporizer. Number four, or the last is use mosquito repellents. Use mosquitoes repellents. The next is clinical trial. Clinical trial is preclinical, phase 1, phase 2, and phase 3. Preclinical is lab studies, phase 1 is human safety, phase 2 and 3 is expanded safety. The next is risk zones. Risk zones, you can see that. Yeah, the red is high risk areas with Aedes aegypti and dengue epidemic activity. You can see that America and Asia, America and Asia. Yellow is medium risk area infested with Aedes aegypti. Indonesia is red, high risk. Okay, and medium risk, no. It's Australia, Africa, and South American. Okay, you can see that is South American, African, and Indonesian. Indonesian is red. Next is quote. This is quote from Duane Kubler. Dengue fever is currently one of the most significant tropical diseases, although it does not harm a large number of people. It has significant economic and social impact. The next is research and research. You can see that. This is I take research and I take research and passed in this PPT. Thank you. Yeah, thank you for everyone.